You may have been very anxious in the past, in a group or by yourself. Now, let's talk about generalized anxiety disorder, or GAD as it is more well called. GAD, what is it? What is the reason behind this? How does it impact day-to-day existence? And how do we confront it? What is generalized anxiety disorder? So, generalized anxiety disorder is a mental health illness defined by excessive anxiety that lasts more than 6 months. People with GAD frequently experience anxiety about a variety of topics, including job, health, and social connections, even when there is no obvious reason to be anxious. Your GAD. The causes of generalized anxiety disorder (GAD) are not fully understood. However, various factors are thought to have a role in its development. Here are some probable causes that could lead to you experiencing GAD. 1. Genetic factors. GAD is more common in families, implying that genetics may play a role. Individuals with a family history of anxiety disorders or other mental health concerns may be particularly vulnerable. 2. Brain chemistry. It is believed that an imbalance of neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine, contributes to anxiety. This imbalance has the potential to alter how the brain manages emotions and responds to stress. 3. Life situations and environment. Chronic stress or past trauma, such as abuse, the loss of a loved one, or difficult life situations, can all trigger GAD. A stressful or conflict-filled setting might also increase the risk of excessive anxiety. 4. Personality. Some persons with specific dispositions, such as perfectionism, shyness, or a predisposition to think negatively, are more likely to experience GAD. 5. Biological factors. Hormonal fluctuations, chronic illnesses, and other physical health issues can all have an impact on mental health and induce anxiety. 6. Social factors. Social isolation and poor interpersonal interactions can also contribute to greater anxiety. Aaron Beck pioneered the cognitive theory, which is one of the hypotheses used to explain GAD. This hypothesis contends that negative thought patterns and cognitive errors contribute to anxiety. People with GAD frequently become locked in a cycle of negative thinking that causes them to feel anxious. To have a better understanding of GAD, consider the instance of Daniel. Daniel is a 30-year-old office employee. He frequently expresses anxiety about his job and his future. Although his job is satisfactory, Daniel is continually concerned that he would be unable to match his boss's expectations or that he will lose his job. His fears made it difficult for him to sleep, concentrate, and spend quality time with his family. Daniel is experiencing various symptoms, including excessive and difficult to control anxiety. 2. Muscle tension. 3. Difficulty sleeping or feeling tired. 4. Trouble focusing. Daniel eventually decided to seek professional help. She was able to identify and change her negative thought patterns thanks to cognitive behavioral treatment. In addition to treatment, Daniel used meditation and mindfulness to manage his anxiety, engaging in regular exercise to boost mental health, seeking support from friends and family. Daniel gradually began to feel better after putting in the effort. He learned not to let anxiety rule his life. Daniel understood that confronting his concerns and getting help are critical milestones in his recovery. In conclusion, generalized anxiety disorder is a serious but treatable condition. Individuals like Daniel, with knowledge, support, and proper assistance, can overcome their anxiety and live happier and more balanced lives. If you or someone you know is suffering from anxiety disorder symptoms, we recommend that you provide or seek support and assistance from close friends or a qualified expert. Remember that you are not alone, and there is plenty of hope for rehabilitation. If you or someone you know is suffering from anxiety disorder symptoms, we recommend that you provide or seek support and assistance from close friends or a qualified expert. Remember that you are not alone, and there is plenty of hope for rehabilitation. Thank you for watching. If you find this video useful, don't forget to like, subscribe, and share. We apologize for any mistakes in the mention of names and other shortcomings. If you have any suggestions or feedback, please write in the comments section.